I lost a lot of weight, so I have a lot of extra skin under my neck.
Sure.
So what can I do for that?
How old are you, Brian?
51.
Oh, I should say that.
That's okay. 51.
51. Well, 51 is an ideal age to lift because the skin starts sagging, and you know, skin sagging on the face is north to south, right? So if you look at this here, you've got skin coming here, but this started up here and came down. And to lift this, we just have to lift them in unity, right? So what I would do is in your case would be, you don't need a full facelift. We'd do a mini facelift, which is just getting the jowl up and the skin, the neck skin up a little bit, and then liposuction this area to help it shrink down.
Okay. So no more
No.
chins.
Much less.
Much fewer chins.
Much fewer chins. To of course get rid of it completely, we'd have to do what's called a full facelift, in which you go and you make an incision here, get the fat out, tie the muscles together, make an incision here, lift this whole skin up, lift it up, and get rid of it.
But that's a big procedure.
That's a big procedure.
Yeah.
You know, full facelift is, we're talking 4 hours under general anesthesia
okay.
and all that.
But I could get by with just having the mini facelift.
Yeah, and if you couldn't, I would have told you, but I think you can get by.
And I won't have a stretched face.
You won't have a stretch.
Okay.
You won't look like Kenny Rogers.
No, I don't want to look like Kenny Rogers. No, no. Not now, especially. He's dead. If I wanted to get tighter skin, is surgery my only option for a long-term permanent?
Absolutely. And the reason is very simple. There are 3 things that happens to the face as we age. 1, the same thing, skin sags. 2, you get surface irregularities, right? Like fine wrinkles and things. And 3, you get volume loss. Okay, some people get volume loss. Volume loss early in life, and we use fillers and fat and whatever to fill that. So we fill for what's lost, right? And then for surface irregularities, we use a surface modality like lasers and things to tighten it up. But for sagging skin, when it falls, you pick it up, right?
Right.
So surgery is really the only option, is to pick up skin that's falling. There's no modality that's going to tighten it to the point where it's going to look like you had a facelift.
Right. Okay. And the same goes for under the arms or
Same
the belly.
belly, right.
So anywhere there's sagging skin, the best way is to get rid of it.
Yeah.
Okay.
You can only cut out skin that's saggy.
Okay.
You can't use a magic wand and make it tighter.
Right. And if you get liposuction, you're still going to have the skin.
Right. Lipo means fat, and suction means suction. So you suction the fat.
Right.
You don't tighten it. It doesn't say liposuction, dermal tightening.
Right.
Right.
Okay.
The dermal tightening doesn't happen with liposuction. Will help the skin, shrink some skin here because it's a special area because of the blood supply and all. But in here, if somebody's got a belly and you liposuction the skin off of the fat under the skin is just going to hang looser.
Right. Okay. So the best option for someone like me would be either full facelift or mini facelift.
For mini facelift with very aggressive liposuction here.
Okay.
And liposuction not to get rid of the fat, which we get rid of anyway, but to irritate the skin enough that it shrinks.
Right. Okay.
And this is the only area in the body you can do that.
Right. So the liposuction will irritate the tissue to where the skin will shrink.
Basically, liposuction will get rid of some of this fat in here, and then the skin will be left, and that skin will be irritated by the liposuction cannula going this way, and that'll help it shrink down. And then we'll also pull it, the mini facelift will also pull the skin out this way. So the combination of this and the lipo.
And where would the incisions for the mini facelift be?
Will be right, in men I make them right in front of the ear here, along the beard line.
Yeah.
So they hide the best. In women I go behind the earlobe. Okay, but it's only from here to here.
Okay.
So there's no incision back.
So it's not like the old days where it's all the way back here.
No,
Okay.
you can go back here a little bit, but in this crease, but not beyond the crease.
Okay.
So
and is it something a lot of men do?
When I got into practice 30 years ago, my facelifts were 1 or 2% of my facelifts were men. Now it's like almost 30%.
Yeah.
So a lot of men are getting into looking better for themselves.
All right.
Why not?
Yeah, I hear you. All right. Well, thank you, sir.
You're welcome.